If I may, given that both of you are parents of children, teens who have gone through this journey, could we talk a little bit more about, how it felt, kind of in the early stages? What were the feelings and thoughts that you were having before you knew what was going on? And then after the diagnosis too?
For me, it was fear. I was, you're a parent. You want the best for your child. You want them to be okay. You want everything in their life to be okay, right? I mean, this is where a parent is coming from. So for me, it was fear. What does this mean? What is this going to mean for them? Is this something, how is this dealt with? Are we going to be missing school? Is there going to be isolation from, I did not know because it was all new to me. So fear was the first thing that I felt. It was actually a relief in some way to know exactly what we were dealing with, because it led pretty quickly to ERP, exposure and response prevention therapy for Catherine, and that because I deal better with things when I know what it is and what can be done. So knowing what it was and what we could start working on as a family and, communicating to teachers, et cetera, so that everybody was involved with the process was huge for me.
Right. And Chris, how about you?
Yeah, definitely fear. I would also say uncertainty. You just don't know like what this means, and you can, depending on where you land on a Google search or a book about OCD, can either heighten that or make you feel like you understand how the process is going to work. And so getting ourselves educated, and I agree with Brian, getting a diagnosis, knowing it was OCD, and then knowing that we were finding a therapist that specialized in exposure and response prevention treatment, understood what it took, gave us trust that we found the right person that can help our daughter. And then you're just you quickly realize, I think one of the biggest realizations that I had, kind of relates to what Brian said. You want to be able to help your kid the same way, when they get a fever, you might give them medicine or antibiotic, or put a Band-Aid on a cut, and it helps them, like you're helping them get better. You quickly realize with OCD, you as a parent are more like the cheerleader or the coach or the advocate. They have to do the work, which is really hard to, you want to help them get better as fast as possible, but it's on their time and on their terms. So you have to quickly realize, okay, I have to go with their flow, and have a relationship to be able to make sure that they are working on what they need to work on, but it's at their pace, and in a way that like helps them get better and doesn't make them recoil from something that's too aggressive.